I am Professor Guntur Revati, Head of the Clinical and Diagnostic Microbiology Laboratory, Aga Khan University Hospital in Nairobi. I am a clinical microbiologist.
My name is Fabian Massa. I'm a medical doctor, specialist in global health, and I work as a science officer at the International Center for Antimicrobial Resistance Solutions, ICARS.
This project is very important for all the low middle income countries where we have a lot of antimicrobial resistance. We have multi-resistant, pan-resistant bugs circulating in the hospitals because of our low capacity for infection prevention and also lack of diagnostics.
TANDEM-ABX is a project funded by Novo Nordisk Foundation, and the objective or the aim is to develop an evidence-based framework for the sustainable introduction and use of last resort novel antibiotics.
This should be targeted therapy rather than available generally for empiric therapy.
So that was even to feed into the social health authority platform. So it is something that I'm not sure we can say how long, but there's progress towards making that happen so that there's interoperability, there's sharing of information and exchange of information that is required.
One key policy guidance for our country is the existence of the Kenya Health Policy and the AMR policy that prioritizes regulation of antimicrobial use, guiding practice, identifying some of the interventions that we are going to prioritize as a country in the different strategic objectives.
Last resort antibiotics tend to be the precious jewel and tend to be the last line of defense in managing patients who are critically ill and with multi-drug resistant infections. And so these antibiotics need to be introduced in a structured way. And so this TANDEM-ABX project will really help in making sure that these structures are put in place, all the regulatory mechanisms are in place, all the training has been facilitated, all the infrastructure needed to diagnose and determine which patient requires these antibiotics is put in place for these antibiotics to be adequately used for optimal patient benefits.
First, allow me to appreciate that this is one of very exciting and brilliant idea to help shape the healthcare sector, and particularly in regards to antimicrobial stewardship and generally acquisition of the right medications, particularly antibiotics.
Yeah, I've really enjoyed the interactions and the discussions that we've had so far, in the sense that there's been a lot of different opinions from different stakeholders in this meeting. And my key takeaway point is that we cannot work in different setups and work on our own, must come together to combat the AMR pandemic that we have. And I like the fact that we were able to look at various stakeholders from the various parts of the community, various parts of the world, to be able to put these thoughts and ideas together to combat AMR.
The TANDEM-ABX project offers an opportunity for multiple stakeholders to come across the table and discuss on these vital things to touch on antimicrobial stewardship. I think the program is a unique opportunity to support the efforts of the government in this emerging issue.
We have gathered here a lot of multidisciplinary stakeholders, including patient advocates, clinicians, pharmacists, IPC practitioners, and also several other stakeholders, NGOs, and they have all discussed by the way of 4 panels, and they have thrashed out several issues which are very tricky. We are unable to face them, and they were all frankly discussed. And even government was asked what is the role of government and how KEMSA can facilitate this, how is the post-marketing surveillance, and all those tricky issues were frankly discussed, and we have chalked out a way forward. And this is just the beginning of the conversation, and these conversations are going to continue. until we reach an ideal pathway for this rollout of the capacity building. And it should lead to some policy decisions and build up of systems.